Gastrointestinal disorders will involve communication between the central nervous system, the brain and the spinal cord, and the second brain or enteric nervous system, which is located in the gut with the intestines. So that's why oftentimes when we're experiencing stress, nervousness, anxiety, we can feel it in our stomach, be it butterflies, abdominal pain, constipation, diarrhea. And similarly, when there's a gut reaction, such as abdominal pain, acid, burning in the digestive tract, that is often communicated up towards the brain. So there is this sort of two-way communication that is going on, and that in part helps us to determine a response, but also helps us to determine thoughts and feelings that we might be having, particularly when we have a GI condition and it's more of an established thing that we're trying to be able to manage. And sometimes the patterns that we learn may be maladaptive. So for example, someone may think that whenever they go out, they're going to have a diarrhea accident and therefore they don't go out. That's not functional, and oftentimes the worrying that is happening in the mind is in excess of what the circumstance warrants. The other thing to also be aware of that is part of this gut-brain axis that we are talking about is how people who have GI conditions are often more susceptible to developing anxiety or stress-related psychological reactions. And similarly, people who struggle with anxiety disorders oftentimes are more likely to have associated GI symptoms that are part of the body's response. Gut-focused psychotherapy can also help increase the understanding of the interaction between your specific GI symptoms, such as bloating, abdominal pain, diarrhea, nausea, constipation, and psychological symptoms, be it anxiety, stress, pain sensitivities, and sleep-related difficulties. We can use this information to apply cognitive behavioral therapy to this model, this understanding, as your behavior changes are happening, will allow you to have better quality of life, decreased symptom experience, and less worry over time, less stress, anxiety over time for potential GI symptoms. And lastly, gut-focused psychotherapy is a brief treatment approach and can usually be completed in 10 sessions or less with the intent of reduction and management of GI symptoms.